It is Saturday, May 9th. Welcome to the COVID-19 Task Force Daily Update. I'm Joe Delarone. We have Lisa Westaway and Lloyd Phillips going to be joining us shortly, but we'll start the program off today with the editor and publisher of the Eastern Door here in Kahnawake, Mr. Steve Bonspiel. How are you, Steve?
Pretty good.
Yeah, let's get right to the point. As the media, you have some special challenges during this this pandemic, but yet you keep publishing. Tell us a little bit about what it's been like for you guys.
Well, finding the stories aside, we have a lot of COVID-19 stories, but finding other stories to try to keep people interested. Luckily there's been things like Recreation Bay contract, Mohawk Online, BC, and fires. It's not good that there's fires, but it's different news because people are looking for variety. Challenges of staying open as well include, ad sales that went down because businesses are closed, and distribution, or 50%, it's down 50%. So where do you sell the paper? Everyone, 50% are closed.
I noticed that in the paper, though, there were some nice initiatives that you've taken to get some of the, some of the support for frontline workers and things like that. Tell us a little bit about that.
Yeah, so we had to think like outside the box. Traditional advertising is gone because of all the companies that are closed. So I started to think of other ideas, how to get that message: stay home, Kahnawake. We're here for you, Kahnawake. And the companies that are open have responded, local and in Chattagee. So we're happy for that because it helps us to pay the bills, helps us to stay open. As an essential service that doesn't get government funding regularly, we have a challenge with that right now. But I will say that the locally, DEWA and task force and anything that we have to help businesses has come quickly, as opposed to the federal government's a lot longer.
Mm-hmm. However, there are some advertising and things like that have come from the government, so that's had to help, though.
Well, the provincial government stepped up, but the federal government has only actually given, I think it was one ad in the last 8 weeks, but the provincial government has definitely stepped up and kept us open and helped us out. So that's good, because I think take that away and we're in trouble.
Yeah. What are people telling you as as you guys sit in your remote offices and try and do your job? What are people telling you about what they're seeing in Kahnawake, and maybe how the paper is covering the action? It's a different world right now, so. Just give us some insight on that.
Well, I think they appreciate that we're covering COVID-19 closely. We're covering different aspects of it, and they want to know what's going on. And although there's so many COVID-19 related stories, there's a variety of them as well. So we're just trying to keep everybody informed and give the right information so people can get it from us, as opposed to going on Facebook and hearing from people, rumors, whatever. Well, you don't know what's right on Facebook. So, tune in here, read the local media, tune into the radio, and you'll get the real story.
Yeah, well, you've been doing a good job out there, I have to tell you, under these trying times and trying circumstances. And I thank you so much for taking a few moments, an hour and then a few moments out of your Saturday. I know you have a lot of things to get back to, Steve, so thanks so much.
All right, thanks, guys. Take care, everybody.
All right, take care. Steve Bonspiel from the Eastern Door newspaper, and a busy guy, too. All right, speaking of busy, Lloyd Phillips is here, and it has been, you'd think that Saturday would be quiet, but there have been a lot of phone calls and lots of things going on here, so he'll tell you all about it. He is the Commissioner of Public Safety here in Kahnawake.
Thank you, Joe. Thank you, Steve. Good afternoon, everybody, and welcome to another edition of our COVID update. Looking outside a few minutes ago to a snowfall, and so hopefully you're inside somewhere and watching a good movie and trying to relax just a little bit on this weekend. I just want to do a few updates. I'll be fairly brief this afternoon, but I just want to maybe clarify a few points, and as well as bring some new information for you to consider over the next little while. First of all, as we talked about yesterday and the previous few shows, a lot of work has been done in preparation and getting information that is going to be distributed to the businesses in the community to help them prepare for the opening. And those documents are still being worked on. We had a few glitches in some of the information that we want to ensure that we want to make something as clear as possible. So that will be coming out very, very shortly. And I apologize for any delay that may have had, but we'll get those to you very shortly. Also, along the lines of business, and it kind of runs parallel, because people have been wondering about some of the works that are happening in the community, either by Public Works or by the capital unit of MCK. They are still on essential services only, and any work that they do perform is passed through the task force, and to ensure that it is assessed, and if it's deemed to be of an essential nature, and then it's approved. So if you see, town workers, as we frequently call them, out and about in the community, the work that they're doing has been reviewed and looked at by the task force. And if it's for a health and safety issue, water and sanitation, ensuring our water supply is good and clean, and those things of those natures, those are things that are definitely approved, because the maintenance of our infrastructure in that area is obviously vital to the future safety and health of our community, and we don't want to do anything that would jeopardize that. Also, I just want to mention, as you may have noticed in the previous announcements, in the Montreal area, they have pushed back the opening of any stores and retail stores in the greater Montreal area till May 25th, and this also includes schools. But no, the greater Montreal area is much bigger than just the island of Montreal. The greater Montreal area includes what the area that they call the Montérégie, which we commonly call the South Shore, including Châteauguay and Saint-Constant and stuff. So everything that they were planning to be opening up has also been pushed back. So their retail stores and such are not going to be opening. They're still operating on essential services only. As you may have been out there, there's certain businesses that were approved for opening, and that's as far as they're able to go until May 25th. And obviously that's pending further review. And this is based upon, in part, new information or analyzing the new information from a medical perspective that Lisa will touch on in just a minute. But some of the numbers there are potential negative impacts are really quite scary, to be quite honest with you. And she'll explain that to you just more in a little while. And maybe just to be clear on one area, there was a rumor, I'll call it, that was circulating in the community that the task force has agreed to the date of May 18th for the opening of businesses in the community. I'll say for you and confirm with you right here today that that is not the case. We are not looking at opening on the 18th. There are too many unknown factors. There are too many risks to our community to consider the 18th. So if you heard that somewhere in and around the community, that information is not true. We still not have decided on a date based on, again, like I said, many factors. I also want to touch on one other issue that is somewhat disturbing, and I want to bring it to your attention that some of these things that are being studied regarding this COVID virus. As you know, it's a novel virus, it's a new virus, something that the world has never seen before, and so now they're starting to see different impacts on different people. Some, as we all said before, some people get it, they only get minor symptoms and they recover. Some get very ill, and unfortunately for some people it's fatal. And for a long time they've been the messaging was, well, children are somewhat immune, or they're only going to get little sniffles, and they were it was not really a concern, which is true for the vast majority, and most children will get the virus, and if they get it, they'll have minor symptoms and they'll fully recover. But there's some more and more studies that are looking at this and saying that there's certain post-infection repercussions or diseases that come forward. One that's called a Kahnawake disease, which is basically an inflammation of all the vessels in the body. And it's a very serious disease. Mind you, it's a very small percentage But it's something that's being studied, and it is quite alarming because that kind of changes the way we're thinking a bit, because we were mostly concerned about the elders, but we also have to don't forget we have our young ones as well, that's our future, that we have to make sure that whatever we decide, we have to take their health into consideration as well. I'm not saying this out here to try to put fear in anybody, but again, it's something that has been on the horizon for some time, and there's more and more studies that are trying to really nail this down. But it's something that we all have to pay attention to it. Part of the role of the task force here is to keep track of what's happening, not only in Kahnawake, but what's happening around the world, and bring that information to you in a short, concise fashion. So maybe now you could go at home and watch the news and pay attention to these things. Because these are all the factors when we're making decisions for our community. These are some of the things that we have to think about, because moving forward, we want to make sure, again, first and foremost, the health and safety of our community will always trump everything else that we do. With that, I want to end off by saying Happy Mother's Day to all the mothers out there, especially to my mom. She's at Calgary Memorial Hospital Center. Unfortunately, I haven't seen her in over 2 months, but I know she is as safe as she possibly could be. So with that, love you, Mom, and I'll see you soon. Onigawahi.
Nicely done, Lloyd. Lloyd makes a good point about the other impacts that this disease is having. And I know that many of you, myself included, we hear about the burnout of this. We hear COVID-19 every day, and as a matter of fact, we're here every day talking about it. And people tell me that, geez, I hope we don't have to see you anymore. The fact is, though, there are things that do happen, and I know a lot of you just watch this program and nothing else. So it's good that we do bring other stories out there a little bit, because it's a big world and lots is going on, and that is just one of many. So if you're not paying attention, there are certainly lots of things on the news. They're not all good, but some of them are terrible, but some of the things are good. We'll get to some of that at the end of this broadcast. Meanwhile, as Lloyd mentioned, Lisa Westaway would be in to continue with the report, so let's bring her in. She's the Executive Director of the Calgary Memorial Hospital Center, and of course a member of the COVID-19 Task Force.
Thank you. Good afternoon. So I'm going to just give a little bit of information that relates to the discussion that Lloyd had with you just a little bit earlier. Some of you may have seen this. There were two newspaper articles, one in La Presse and one in the Gazette today, that have been circulating, which refer to a new document that was released on the 7th of May and updated on the 8th from INSPQ. So that, as a reminder, is the National Institute for Public Health in Quebec. It's the research arm of public health. And what they're doing is they're examining predictions of loosening up of social distancing, of reopening of business within Quebec and in particular in Montreal. And they're, in their document, they're highlighting some major fears regarding the Greater Montreal area's reopening, even for the 25th of May. So what they've compared between Greater Montreal area and other regions. Other regions, they feel that is less of a worry. If there would be opening up and less social distancing, yes, there would still be increase in number of cases, increase in hospitalization, increase in death, but this increase would happen, it would be a much less drastic increase, and it would happen very, very slowly, so it would be controllable. However, in the Greater Montreal area, which Lloyd mentioned does include our area, it does include Kahnawake, the increase would be more drastic. So what they're estimating, what they state is that when you reopen business, you're essentially increasing contacts by approximately 15 to 30%. And they have two tables in their document, and if you go to their website, you'll be able to find it. Right now we have it in French. We're going to have it translated and posted on our website. But maybe we'll just show you the first table. Because it really demonstrates a lot of uncertainty in what's happening right now in the Greater Montreal area. So in this first table, you see the impacts of on the level of hospitalizations per day in the general population, both in the Greater Montreal area and other regions. So you see very clearly the increase. So that grade off or area in May shows about how many hospitalizations we are having per day. It's about 100. And with the loosening up of the rules and therefore an increase of 15 to 30% of contacts, we see an increase up to about 500 hospitalizations per day. So that's a drastic increase. If you look in the table to the right, that's the other regions. That does not include us. So again, I just want to make note of the fact that these numbers are really specific to the general population. So it's not just people who are getting more sick in long-term care facilities, and I'll mention that again in the next slide. So on the next slide, we're looking more at the number of deaths per day. So what this, the INSPQ research demonstrates is that there's a potential of an increase up to 150 deaths by July should we start opening up and increasing contacts by 15 to 30%. This is a huge increase. And again, just to note that those 150 deaths per day do not include long-term care facility deaths. So this is above and beyond. Earlier in this document, we see that there has been some stabilization of number of deaths from long-term care facilities, but we still don't have enough data to know if that's really the case or if it's just been a short stabilization and if we're still going to continue to see increases. So this is very worrisome, this research, because it really demonstrates the great uncertainty, and it's based also on the fact that there's only 15 to 30% of increase in contacts. However, we know that as we start opening up, people become, as much as we've mentioned that we have to continue to self-isolate or social distance, we know that that becomes less and less obvious, and people tend to think that they're safer because they see things opening up around them. So again, that's a scenario. The 150 deaths per day is a scenario with only 15 to 30% of extra contacts, whereas we can potentially see a lot more contact and therefore a lot more cases. So I guess the message that we want to give today is that we're not giving a date for reopening of business for a really good specific reason. We're really looking at the health of the population. It's paramount in the decisions that we take. Based on this new data that came out today, it further reinforces the fact that we are not ready to make decisions about that. Yes, we've announced and we've talked a lot about business reopening because we want to prepare and we want to make sure that our community has the support that you need to be able to make your plans for moving forward. But we still, based on this evidence, cannot make any firm decisions about when we would want to reopen. So that I'm going to change subjects a little bit and go back to Mother's Day, something positive, and I would like to wish you all a very happy Mother's Day as well. It's really take the time to speak to your mom and have some nice moments with your family. I want to talk a little bit about KMHC because, as you remember, we are allowing you to drop off items for your loved ones, and that is between 10 and 1. It's at the testing site area, and we will be having people who are who will be there, who will be picking up what you're dropping off, and will be making sure to clean it. We would not make any decisions we would not put this in place if we didn't feel that it was absolutely safe. So I just would like to reassure you that the measures we're putting in place will ensure the safety of all of our residents. Some people have asked about the flowers and have expressed some concern. So I did speak with Dr. Gauthier, and because I'm not as humorous as her, I'm going to actually read the text that comes directly from her. In her sense of humor, which you already know about. So Dr. Gauthier states, unless you stick your head in a bouquet and cough or lick each flower, there is infinitesimally small transmission. So all that to say that you do not have to worry. We will accept your flowers. please no just cut flowers without a vase. We at KMHC we don't have the ability to put flowers in a vase, but everything will be, every vase, every item that comes in will be thoroughly cleaned and sterilized so that you don't have to worry about your loved ones. So with that, again, happy Mother's Day. Hopefully we'll see the sun tomorrow. I would enjoy that. Thanks.
Flowers are always good. All right, just to mention that a couple of things here. For Mother's Day, if you go to the Kahnawake.com site, you will, it's actually the MCK Facebook site, you will be able to record greetings for your mom. And if, we'll be posting those, and we'll have at least 2 winners, somebody doing a greeting in English, somebody doing one in Kahnawake. We may have a couple more prizes, but it's really an opportunity for you to say Happy Mother's Day to your mom. So that's it. Just a reminder as well that on Tuesday, this coming Tuesday, don't forget, there will be a parade around Kahnawake to say thank you to our first responders and people on the front line through all of this. And we talked about this the other day, and more details will come. They've been talking about it on K1037, of course, because Sandra Sherman, who's on staff, there's a person who's really taken this bull by the horns, as they say. So good for her. So anyway, we thank you for your patience today. I know we started a little late. We had some technical difficulties, but we'll be back tomorrow with our daily update. And as Lloyd was saying, sometimes there are rumors out there. Watch this report every day, because every day we tell you what's going on right up to the minute here in Kahnawake. You don't have to listen to people who are starting rumors. We have the facts for you right here. So on behalf of everybody, have a good day, and we'll see you tomorrow. Nyauko adano onigiwahi.